Hey guys, I'm Ruhi, and then Christina and Shelly. We are presenting to you scabies and lice today, and the reason we are presenting scabies and lice together is because they both come from a mite. Now the mite is what causes scabies and lice, and the way we treat it, the way it is spread, and the way that, it basically is transmitted is through this mice. And that's why scabies and lice is so similar. Now, to treat scabies and lice, we use the doctor will prescribe something that would kill this mite, and that's another way they are similar. Basically, scabies and lice is transmitted from person to person, not through animals or anything like that, as will be discussed later in the presentation. Now, we do have a handout and NCLEX questions that we will present at the end of the presentation, and we will also have our questions at the very end. Thanks for listening.
Hi, I'm Christina, and I'm going to talk to you guys about the natural life of scabies. The groups that commonly get scabies are young children, mothers of those children, sexually active adults, elderly living in nursing homes, and people with weak immune systems, like HIV/AIDS patients, cancer patients, organ transplant patients. They are getting scabies from a mite that is actually going to burrow into their skin. And it's not the same kind of mite that you can get from any kind of animal. It's a human mite that goes from contact from human to human. You can't get it through a handshake or a hug. It has to be for long periods of time in human contact, and that's why adults that are sexually active tend to get it when they're next to each other. There are about 300 million cases of scabies worldwide, and 1 million of those cases are in the United States. People will usually go to the doctor or go get over-the-counter treatment for the itching or an infection that they get from scabies, but you have to actually go to the doctor and get a prescribed medication that can kill the scabies mite. Then you can go home and wash different clothes or bedding or anything that's had contact with your body when you've had scabies. Natural history of lice. There are 3 different types of lice. Head lice, all over body lice, and pubic lice. Common populations that get lice are young children in daycare and school settings because they're sharing items, and it can be spread just like scabies from contact between humans. In the United States, body lice can occur only in persons, it commonly occurs in homeless people or transient people because they're not usually having the ability to take care of themselves hygiene-wise and shower weekly, where they can get rid of the lice that's on their body. Treatment for them is going to be similar to those that are treating scabies because they're going to want to take all the clothing that they've had on when having lice and go and wash it or get rid of it, and they can go to the store or to the doctor and get a prescribed pediculicide and use it as a shampoo and a body wash to wash all over their body, and they can use a fine-tooth comb when they're shampooing their hair to go ahead and scrub those lice from their scalp. Okay, now I'm talking about the risk factors, and the risk factors for scabies and lice are so similar, I'm going to talk about them together in general. Some of the risk factors are being in close populations with people that have scabies or lice, like children that go to daycare settings with lice. The other children are at risk for contracting or for getting the lice during contact. Mothers of children that and their child has lice or their child has scabies, the mothers are then at risk for getting it during contact. People in close environments that are living together, it's often seen that if one person will contract scabies or lice, then it will spread through the community. The barriers and environmental issues are also similar for scabies and lice. Living in crowded areas, in places in healthcare settings, and when scabies will get detached from the person that has scabies, the mite is able to actually live for a week without the human contact, so people can come and get it weeks later, like on items like towels and furniture that a person that scabies has had. And lice is not the same in that way because lice has to live on sucking from human blood once it's burrowed in the skin. And For health status nationally and globally, scabies across the globe is common. More common in urban areas and with women and children. There's also a higher number of incidents or cases seen in females, probably because of the hair factor, and they tend to share things more often. But you can't spread scabies through handshakes or hugs. Often when it's seen in the elementary setting, it's because people in that area, they've shared mats, and so the mite has been able to live on that and then it's transferred to another person during contact. And then we're going to talk about prevention strategies.
My name is Shelly, and I'm going to talk to y'all about the health status nationally and globally on lice and scabies. The actual number is impossible to determine because lice and scabies are not a reportable disease, so people a lot of times care for themselves and don't seek medical treatment. Some prevention methods are, primary prevention would be educate. You're going to educate the children, educate their families. You can send the kids home with little packets of information. You can teach a lice class just to kids on basic information on how to avoid getting lice, which would be things like avoiding sharing hats and blankets with the other children. For secondary prevention, you would have the parents routinely check their children for lice throughout elementary school, have the parent or teacher report suspected lice to the school nurse, notify families of other children that there's an outbreak, and assess the patient complaints that may be scabies and confirm the diagnosis. Tertiary prevention would be treat the infestation, scabies or lice, wash and vacuum the things that have been in contact with the scabies, such as bedding and linens and clothing, reassess the household members for signs and symptoms of infestation, and re-alert close contacts. For the nurse, you would inform people that there's an outbreak in the school without naming anyone's name. You should maintain patient privacy. An effort should be made to inform the people that have been in contact with the person about the lice outbreak to decrease the chances of spreading. The nurse should offer information on lice treatment and how to get rid of the lice in the household after an infestation. The nurse can give information packets to reinforce the information and should encourage a follow-up appointment to reassess whether treatment for the lice or scabies has been effective after the initial 10 to 7 day treatment.